So, hi everyone. Hello, dear listeners. Welcome to CareSmartz360 On Air. I'm Dennis Gill, Senior Sales Consultant at CareSmartz360. Today, we are honored to speak with Cheryl Hamilton Fried, founder and CEO of Harmonia Health, and a seasoned healthcare executive with decades of leadership across hospice, home health, palliative care, and value-based care. Cheryl's visionary approach to organizational growth, care innovation, and strategic partnerships has transformed non-acute care delivery, driving quality, sustainability, and impact. So get ready today for insights that will shape the future of care. Welcome to the podcast, Cheryl.
Great. Thank you. Thank you for having me today.
And we're really glad you were able to take out the time for our listeners today. And I hope this session would be a very fruitful one for all the listeners from all over the world who will be going through this session.
Great.
So I'll just straight away jump in with our first question that I have for you. So, Cheryl, what must be the top strategic priorities for home care agencies to grow sustainability in 2026?
I personally think that if your short-term goal is to increase census, then
Mhm.
you're missing the boat. The long-term strategy is something you really should be thinking about.
Okay.
Um, you know, how I have been able to build my career, I have gone to organizations and diversification has been really probably picked up in the last 10 years, meaning hospice is moving into PACE programs or home health and hospice or primary care. I just feel that diversification really is helping with the continuum of care. But
Hmm.
I'm having recently, and one of my aha moments in this coming year, and something that I'll be researching and determining the right direction.
Hmm.
Um, but that is basically looking more at the vertical. It kind of surprised me that the senior living markets and the long-term care markets are really focusing on a more holistic or a more broad continuum thinking about care. But are we really doing justice? Meaning that if you don't have an idea for what the future is going to hold, then let's say, for example, finding additional revenue streams or anything that would um, look at intentional growth, I guess is what I'm saying. And is it the right thing to have people in multiple programs along sort of their last stage of life? And in each of these specific niche programs have their own primary care physician. So you have to select the primary care physician for this new program. And then the new program you have to select. So it's great to have it all in one bucket, right?
Yeah.
But what we're missing though is that we're still kind of siloed. My concerns are those organizations that are just after palliative care or just after hospice, and
Okay.
they're looking at growth, but they're really not looking at operational efficiencies and again, really intentional care and an intentional scale.
Hmm.
Does that make
Okay.
sense? Nick, follow?
Yep. Yep. It does. It does. And what key metrics should agencies track to measure success in value-based and non-acute care, according to you?
So I'm sorry, repeat the question. The
Wait,
key metrics that
key
actually
metrics,
matter. Okay, yes,
key
yes.
metrics, yeah.
So visits and census are lagging indicators of those things. And so what really matters is outcomes and efficiencies. So when you look into an organization, in particular now with AI,
Mhm.
um, when you look at an organization, you're looking at streamlining and operational efficiencies and outcomes is really what's going to matter in the future.
Mhm.
So when you're looking at value-based care, you're looking at things outside of just the length of stay or outside of just ED utilization, but those are all things that we should be measuring. Referral to admission, margin by payer. I had a personal situation real quick that I'll let you know. I had
Sure.
our revenue per patient day was slowly clipping down.
Hmm.
And so we're trying to figure out why our revenue per patient day was found. And what we found is that the per diem pay in one of the counties that we had selected as a primary target for growth,
Hmm.
um, one of those counties was the lower per patient day reimbursement. And so our overall per patient day was was not growing as fast as that. And
Okay.
so, yeah, so when we entered into, again, expansion of services, we did a de novo, but primarily we had a miscalculated marketing study,
Oh.
which did not show us that where we had put into our marketing plan,
Hmm.
we didn't adjust the revenue to um, make up for. Um, we didn't have anything else to look at. We didn't have the capital.
Okay. Okay. So that was the case that we want to discuss about. And anything you want to discuss about that, how the agencies can demonstrate ROI to peers and referral partners?
I'd like to include first workforce if I can.
Hmm.
And I think that workforce stability is extremely important in providing care to individuals. And
Yeah.
so having a very robust orientation and mentorship program is critical. Because again, we're not operating into the max amount of visits per day. We're operating in a world that the outcomes in health are going to be improved, but our
Mhm.
margins are also going to be positively impacted by, the increase in utilization at that point.
Okay. Okay. So that does demonstrate ROI to that. And what technologies or data capabilities are must-haves for future growth?
Predictive analytics,
Hmm.
um, ease of use for the clinician at the care
Okay.
at the bedside,
Got it.
um, training in basic technology.
Mhm.
I think we have, in particular, when you're looking at home care staff, we're looking at staff members that are of an older generation.
Yeah.
Yeah. And so it's important for us to groom people, have them stay, and have them be consistent for our
Mhm.
patients. In particular, if they're long-term, I still think it's incredibly important the bond that our hospice caregivers or our home health caregivers provide at the bedside. But it's really important that we make their jobs easier so they can make the patient experience better. And what that means is being able to dictate, being and have it right into your system, being able to, but I get a lot of copy and paste when I go to places and that drives me crazy.
Okay.
But documenting at the bedside is very important.
Uh-huh.
Um, and I think it's the continuity. And when you have all home care, and even though you have shift changes in hospitals,
Hmm.
um, it's the continuity, I guess, during that time and you where hope shifts from a cure to
Hmm.
quality of life. And so, you know, I think that's all I have to say about that.
Oh, okay. Thank you. And what workforce strategies help recruit and retain top care talent, according to you? Specific any workforce
What
strategies?
we've done, we kind of sign-on bonuses were pretty much what everybody went to during the pandemic.
Uh-huh.
And so we've continued that with several types of incentives or hard to fill staff, but our culture really said it all.
Mm,
And when people met us as a leadership team, I've been fortunate enough to build strong cultures that it's a place somebody wants to work. It's showing appreciation. It's
appreciation.
giving perks here or there. I bought dinner for CNA's family because she took an extra visit that night
Mm,
that had to be covered.
yeah,
Um, it's things you do throughout the year that makes your staff really engaged. But the EMR obviously is a big, big issue, and getting everybody to talk to everybody is really
that's,
difficult. And
that's
that's going to be a challenge if you are in healthcare, which I was in a healthcare system that offered multiple service lines, and I was involved with a couple areas that meet.
basically making them more ease of work culture that is there, and they
Yeah.
find it pretty easy. And obviously, the perks that should be there here and there. We definitely buy that point.
Absolutely.
Yeah, we definitely buy
Absolutely.
that
And
point.
we've chosen super users for
Uh-huh.
each of our teams. Um, but it's good to have the ongoing education about new releases and things like that. So that's always what we look for when we're looking at a provider. And of course, um, what service lines can they handle? I
Hmm.
mean, for post-acute,
Yeah,
are you talking about senior living to hospice, or senior living to a PACE program to hospice or home health and hospice? It's I think it's so much more than what we've been doing for the aging
uh-huh.
um, in the last 10 years, but we really need to, get caught up with as rapidly as things are changing. In particular, I think for hospices.
Uh-huh.
I know home health is having some issues right now as well from a reimbursement standpoint, but it looks like some of those have been resolved. Hospice, not as much,
Okay.
but there was some new legislation out, but I guess my point is that if you had a platform or an interactive platform to hold all of these different interfaces
Hmm.
and be able to give a clean summary, provide an overview of access to assist in determining eligibility,
Got it.
um, making sure that notes are in case the night nurse comes in.
Yeah.
In hospitals, again, they do live transfers between nurse and nurse. They don't always
Yeah.
do that in hospice. We don't have a chance. And in the middle of the night, you don't. But what I can't stand is a caregiver that comes into my house in the middle of the night and wants the whole history while I'm in a crisis.
Yeah, I get the point.
Yeah, because I see that quite a bit. Yeah.
Completely by the point. That definitely should be there. And
Yeah.
finally, the last thing, Cheryl, what's one shift home care leaders must take now to thrive in tomorrow's care landscape?
One.
Specific
Wow.
one. You can name multiple also, but specific one, if you want to name.
Um, I guess I will say that information and or investment in um, infrastructure is what I'm trying to say.
Okay.
Investing in infrastructure is going to be crucial before growth.
Uh-huh.
And we really need to be ready for that. And so I think um, looking at ways to invest in infrastructure, I know this is more than one,
Hmm.
and being provider centric, not thinking about partner centric leadership.
Okay.
And that non-acute care isn't an ancillary service anymore. I mean, this
Yeah.
is just something that is foundational.
Hmm.
And the leaders that recognize that will be ones that are surviving and hopefully thriving in the future.
Yeah.
And so I think we're headed to non-acute. But again, one of the burning questions in my head is that in some populations, does it make sense to have all of these wraparound services, even with when you're living not at home, but not in a skilled nursing facility like an independent or an ALF?
Okay.
Uh, so that's where I feel like that's going to be most important. Um,
That's what.
I
That's
think that's all.
yeah. So basically, we can start with the infrastructure you said. And what do you think about the AI? Do you think that could be the another thing where the agencies or the home
Mhm.
care owners, I would say specifically, they should be more on the toes with that. Like because as we see now, all the things AI is coming in, and AI knowledge, AI training, and I
Yes.
think yeah, the agency owners they should be aware of that thing, and more time would be devoted in future on that. Rest, we are not sure what future holds.
Mm. Yeah.
Yep.
Yeah, it's
Okay. So
uncertain.
it's completely uncertain. Yeah, we are not sure what future
Yeah.
holds
Yeah.
because a few years back, if somebody would have told us AI, thing of AI is coming in, we would not have understood that too. But yes, it's there, working for us.
Of
So
course.
yeah,
Yeah. Yeah.
because in our
Yeah.
system,
I
also,
think
yeah, sorry,
the
please.
way I've used it has been really more so in the access area into streamlining all of the medical records that we
Mm.
receive and pulling out the predictive analytics to determine if this person is appropriate for hospice, per se, and that there's good information that can be gathered out of that that would help the physician assist them in determining appropriateness.
Yeah,
I'm fascinated by that because I've always been the first one at the bedside wins.
definitely, you're correct in that.
But
Okay. So yeah, Cheryl, thank you for your time today. It was quite
thank
an
you.
informative session. May our listeners will definitely go through it, and they will have knowledge, a little bit knowledge, whatever we could provide them in this short
Mhm.
span of time. And we would definitely like to connect with you again in the future for some other insights on this program. Right?
Absolutely.
All right. And thank you, listeners. Thank you for your time today. So I'm Dennis Gill signing off today. So I'll see you soon. Bye bye.